health conditions of the workers engaged in around 1,000-odd tea gardens of Assam, their families and community in large, has always been a matter of concern for all, be it the management, the companies or the government. Inadequate health facilities in the tea gardens had even become a major tool for the political parties to garner votes during elections for several decades. Even today, there are many tea gardens which do not have a proper hospital or dispensary, and even if they have one, it does not have a doctor or a pharmacist. It is not only that the managements do not wish to appoint a doctor in order to take care of their workers and their dependents, but many a times it is hard to find a doctor. In order to address this very critical issue, the Assam Company Limited, which has 14 gardens in Assam, has started telemedicine services in its garden. The company is the oldest tea company of the world, being founded by the Britishers in 1836. There are around 75,000 people staying in these 14 gardens, and among them around 16,000 are workers. The company has roped in the services of a New Delhi-based NGO named WISH, or the Vadwani Initiative for Sustainable Healthcare, which is implementing the schemes on ground.
The healthcare mechanism in the tea gardens of Assam has always been found to be wanting. In order to address this critical issue, the Assam Company Limited, which is the oldest tea company of the world, has introduced tea medicine services for the benefits of its workers and the community in the gardens which are spread across Assam. Now, through this telemedicine, the services of the doctors will be made available to each and every worker, and whoever sought medical attention in the hospitals and dispensaries, in fact, and other healthcare centers of the tea gardens. This will benefit the tea garden workers. Now, to know more on this, we have the doctors of the company here at the Greenwood Tea Estate, which is in Dibrugarh district. We would like to go and interact with them.
And accordingly, the NGO is setting up the network to connect the gardens. Doctors will provide medical services to the workers and their families from the hub created at Greenwood Tea Estate of the company. This was informed by Dr. Purnanand Count, the Chief Medical Officer of the company.
We have with us the Principal Medical Officer of Assam Company Limited, Dibrugarh, Dr. Uday Saha. He has experience of around 4 decades of serving in the tea gardens of Assam as a doctor. So, Dr. Saha, what do you feel? Introduction of telemedicine in the tea gardens, how will it benefit the workers, the people in the community?
Yes, telemedicine is a very good thing actually, though it is newly coming some time back, but 40 it is a new thing. And since most of the tea gardens are in remote areas and the referral centers are away from the main hospital of the tea gardens, so telemedicine will definitely help the tea garden doctors, hospitals and the people of tea garden. It will help definitely.
Sir, as we have learned that the Assam Company Limited, which is the oldest tea company in the world, is going to introduce telemedicine services for its worker. So, please elaborate on this.
Yeah, first of all, thank you for coming to cover this important, I should say very important aspect of our healthcare. Telemedicine, as you all know, it started in India, of course. It started somewhere around 2000 or 2001, if I am not mistaken. Maybe the first one to start in India was the Apollo Hospital in Chennai. They have their rural healthcare services, and to link the rural healthcare services with their specialist care in the main hospital, they have started this telemedicine service. It's a wonderful concept, I must say, and I am associated with this I'm happy to be associated with this since 2015, beginning of 2015. Even big hospitals also in India, they have the telemedicine facilities, and it's helping so much, the patients. Like after our initial checkup with the patient, follow-up checkups, many patients could avoid because of telemedicine with the big hospitals. In Assam Company India Limited, we have introduced this to strengthen our primary healthcare sector. As you all know, in tea gardens, we provide the primary health care. In many places, you will find a shortage of doctors, and also in some places, like in big hospitals, we have setups like we call them dispensaries. Any big hospital where the garden is little bigger in size and lines are distant from the main hospital, then we are supposed to have one dispensary over there. So we have dispensaries in quite a few gardens in the company. And in those dispensaries, normally we don't keep permanent doctors. Only the pharmacist and the nurse stay there. And of course, the doctor from the main hospital, he makes a visit, maybe daily basis or an alternate day basis. But most of the time, the center is without a doctor. It's run by the pharmacist or the nurse. And if they feel that any patient needs to be sent to the doctor, the patients are sent to the main hospital. That is the normal practice which which go on in the dispensaries. Now, with this telemedicine concept in our company, what we are doing, this is called a hub and a spoke model. Hub meaning where the main doctors will sit. In this company, Greenwood is the registered office. In the hospital at Greenwood, the CMO or the PMO sits over here.